My name is Chloe. I'm 30 years old and I was diagnosed with ADHD when I was 28. And so far it's been a great journey. I have curly hair, so I have to take care of my hair. I have ADHD, so I have to take care of that too. And how can I? Sorry.
Yeah, that's okay.
I'm the youngest of 3 siblings, and the thing I always heard from my mother and my father is that I was always different from them. My brother and sister, they were always calm and chill and really low maintenance, and I was the complete opposite of that. So I would talk all the time and I would be singing, and when I would not be singing I would be dancing and I would be making shows for everyone to see. And in school that was really bad too, because I could never sit quiet for more than, I don't know, 5 minutes. So my mother would be constantly called into school.
We go back to the idea that ADHD is a neurodevelopmental disorder. So neuro meaning it's brain-based and that it occurs in a developmental context. So people who are struggling based on what we would expect of their developmental age or stage are going to be diagnosed with ADHD. So for example, the frontal lobe here is the center of our brain that controls a lot of how we regulate ourselves, how we regulate our attention, how when we know we need to focus on this in front of us, we drown out this here, or the idea or impulse that we want to do something else. It's about how we regulate our emotions and our reactions to things. It's how we regulate our impulses to, I have this idea, I have this, I want to do this and this, but I didn't finish this. How we, when we're fidgety, but we know we should be quiet and listening to someone else, how we stop those impulses. So this all is part of what everyone's brain here in the front does, but we understand that individuals with ADHD maybe are learning those skills slower when they're growing up. So again, developmentally, they're not in sync with their peers, or as adults, they find that they just need a lot more supports, reminders to do those things of the frontal lobe.
The hyperfocus is something that's bizarre about me. Like, I can, if I am seated, I built this quite comfortable office for me to work from home, but I can work for 30 minutes tops without being distracted. But if I go to a cafeteria and there's a bunch of noise and everything going around me, I can sit for my record is probably the one time that I sat still for 6 hours and did nothing else but writing. So the hyperfocus for me is really significant, and that's something that I know that it does not come from my personality. Being so into my own self-discovery process and being on therapy for so long and writing about myself and what I'm feeling for so long, I did develop the ability to perceive what I'm feeling. So if I'm feeling down, I will even tell my siblings or my husband, I'm like, I don't want to know. If there's something bad going on in your life, I'm really sorry. If you need money, ask. I'll give it to you, but if it's not something that I can directly do for you, please don't tell me. I'm already feeling down. The first time I did it, it was really awful. People were like, how? Like, you're not going to be there for me. But then they got the gist of it and they understood, and nowadays it's easier, but that's something I do too. If I'm in my high spirits, then it's fine. You can tell me anything. It will bother me, but it will not bother me as much. But if I'm feeling sad, then yeah, I'll avoid.
ADHD seems to be increasing a lot, partially because there's just been more attention, more awareness of what ADHD is, and also, in truth, it's a very common neurodevelopmental disorder to begin with, affecting anywhere from 5 to 8% of school-age children. If you imagine then, that's going to be at least one child in every classroom.
Having ADHD is not easy, especially in a world full of distractions. It's really not easy. But it will get harder if you just accept it, wear it as a vest, and go live your life like it. Oh, I'm sorry, I didn't respond. You know ADHD. And people make jokes about it. I'm like, that's not funny. That's a mental health problem. Like, that's not okay. So I never joke about it. I try not to. It's not just the magnitude of the reward itself, it's also how quickly can I get it. So if it's not immediately there, then I'll procrastinate. So and my gateway is usually, because I know that different people, different gateways, but to me, it's usually maybe binge watching something on Netflix, or I actually, which is kind of bizarre, or counterintuitive, but I read a lot when I'm procrastinating, but I will read other stuff, like I can read 3 or 4 novels a week sometimes when I'm procrastinating. I avoided TikTok for 4 years. I don't know how long it's been there, but I only got into it this year. And it's so hard to stop. The way our brains are wired, we're always and constantly looking for instant rewards. And that's for typical human beings as well, but with ADHD it's even worse. The combination of always looking for instant rewards and hyperfocus, it's really dangerous with social media. And that's not only for TikTok, that's for Twitter, that's for Instagram, Facebook.
And we know that our world is a rapidly evolving one that is increasing demands, especially in countries like the United States. So we always have to be mindful of, again, what we're pathologizing, what we're expecting out of natural human behavior, and again, what should a 7th grader typically be focusing on, what should a high schooler typically be focusing on, and what level should they be performing at.
I think that having the difficulty with the maintenance of basic relationships is something too. Sometimes you're lonely because you are lonely, because you made yourself lonely. Like, how long has it been since you texted your, I don't know, your friend, your best friend? How long has it been since you called your grandma? I can go 6 months without talking to Mai and not even realizing it. And I love her to death. I would do anything for her, anything. I admire her so much. I talk about her, I don't know, once a week. Perceiving that I have this problem, understanding that I have a reminder on my phone, and literally once a week, call grandma. And once a week, I have a call a friend. And once a week, I have a text back. And like, it's the things I have to do. And even if it's there, even if the reminder pops up, I'm sometimes like, yeah, not now. Even if I know I should. And for my intimate relationship, I'm married. And something that I really perceive is that when we're arguing, I need to get it, to get the answers fast. I need to have the problem solved fast. So if he's taking too long to think about an answer, I'm like, let's go. So, and that's really bad, because I mean, no one wants that.
So if you're wondering if you have ADHD through what you're reading online, it's great that you're seeking information about understanding yourself, or that you're identifying a problem in your life perhaps that you'd like to improve. The best thing to do is to try to find a qualified mental health professional to help you evaluate whether you have it or not. Online fora are a part of the world these days. We just always have to be careful with what kind of information we're getting. Once we have a diagnosis, using online platforms can serve a wonderful way for finding support for yourself, finding tips, strategies, but I wouldn't use it as the go-to first source for diagnosing, but maybe following a curiosity that you have about whether you have it or not.
And there are studies that indicate that we can perceive social signs more easily. So even if I'm so distracted, I will be more aware than the average person to understand your face language, like what are you trying to say, but you're not saying it. I will know it better than the next person. So I try not to put myself in the center of the world and understand that, oh, he did this, it must be because he wants me to feel that. Or no, maybe he just did that because he wanted to. Maybe he just did that because he didn't know it any better. Or maybe he did that to get into my feelings, but am I going to let him?
The rule, rather than the exception with ADHD, is that it co-occurs with other disorders. And so some of the most common things you'll see happen with ADHD is anxiety or depression. You can also see learning disorders or trouble with learning. There's some idea also that ADHD in and of itself creates anxiety. So when you're expected to perform in a school or work environment, know that you have the potential but aren't, that stress in and of itself of maybe doing less than you know you can create anxiety.
I can feel depressed, as I did actually. I felt depressed and I was working 10 to 12 hours a day. That's what psychologists call the high-functioning depressed person. And when I would tell people, oh, I'm depressed right now, I'm feeling down, and wow, you're working, or you have your makeup on, you're not in bed, what's happening? It was not the whole of me. There was so much more going on. If I had used my depression diagnosis or my ADHD diagnosis as an excuse, I would probably be still there. I would still be taking 2 medications a day. I would still be in bed for most of the day. I don't like to use it as an excuse. I try to, even if I'm thinking it, I try to say it in a different way. Like if I hadn't responded a friend in 2 weeks, I'm not going to say, oh, you know, us ADHD people, how we get, like, I forgot. I'm like, I'm so sorry. I haven't texted you back. It's my bad, I'm working on it. Focus on, I'm working on it. And that goes for anything. So for anything, literally, like if I have a problem on setting boundaries, I'll have to work on it. I understand that I have this problem, but I had to work on it. When or while you're using it as an excuse, you're not working on it. You're just making it control your life. You're letting it control your life. And you're the one that's supposed to be controlling your life, not the ADHD or whatever it is that you have, who you are. And ADHD it's only a fraction of that. Just understand what you are good at. Ignore the ADHD part of it. What are you good at? And where can you put yourself? What places can you put yourself that will make you thrive, or that will allow you to flourish? When I first got my diagnosis, I was like, okay, that's me. So trying to be out of it is pointless. There's no cure. So now I try to see it as part of me, like are my eyes or my hair. I have to tend my hair. I don't have straight hair, so I do have to do some things differently than other women do, or I don't know. So it's a part of me. How can I take care of myself so that I can live the most fulfilling life I can? Having the ADHD, I already have it. Okay, next, what can I do with it?